Hi all, my name is Emily. Welcome to my YouTube channel. I am a stay-at-home mama to my 15-month-old son. Today's video is part one of a two-part series on breastfeeding. Part one, which is today's video, is going to be about breastfeeding, a how-to, what to expect from birth up to a few days post-delivery. And then part two is going to be a few days after delivery up to a few weeks after delivery. So let's get right into the video. What I want to first start out with is latching your baby right after they are born. And what I mean by right after they're born, this is if you have a vaginal birth. If you have a C-section, that is going to change the scenario a little bit, which I will address later on in the video. But if you have a vaginal birth, your baby is going to be most alert for that first hour after they are born. After that, they're gonna start to get drowsy, gonna start to get sleepy. So you want to try to latch your baby within that first hour. I know with everything going on, you just brought your baby into the world, there's going to be this huge rush of emotions and so many people around. You might not be thinking about breastfeeding, but it's really, really important to try to latch your baby within that first hour. Following delivery, what are some of the things that you should be looking for that determine whether your baby wants to nurse? One of the first things is if your baby is sticking out their tongue, which it can be like they're just generally like licking their lips or sticking out their tongue, or they're doing like that tongue thrusting reflex. Another sign could be that they're turning their head from side to side. That means that they're looking for the breast. That's called rooting. Another sign that you can look for is if they are kind of chewing on their hand, chomping on their hand, and that's exactly what my son was doing. I remember it was about 45 minutes after he was born and he started chewing on his hand, and I was like, oh my gosh, I think he wants to nurse. Another thing they could be doing is called like the breast crawl. They could be trying to like push off your stomach, like it looks like a little froggy, and they're essentially trying to find your breast using like their legs as momentum to push towards your breast area. Your baby also could be just opening their mouth, nuzzling, snorting, snuffling. Those are all signs that your baby is wanting to nurse. I know that it's a lot to remember, especially like right after your baby is first born. You'd think that the last thing you're thinking about is whether your baby wants to nurse or not, but it really is important to start that milk coming in and just start establishing that breastfeeding relationship. Now, if for some reason you have a C-section, then you're probably going to be separated from your baby for a little bit. They might bring your baby over to you, but they're probably already going to be swaddled. You might not be able to do skin to skin with them at first. I think that it is a priority for hospitals to try to get you to do skin to skin or breastfeed within the first 2 hours. So it is a little bit delayed. But what you can do if you are separated from your baby for longer than that, you can start to try to hand express, and I'm going to go into that a little bit later on. For whatever reason, if your baby does end up in the NICU, then what you can do to start getting that milk coming in, you can try to start hand expressing or pumping. I really recommend hand expressing. It's obviously you don't need any equipment. It's really easy once you get the hang of it. I would recommend that you learn how to hand express, but I would not try it on yourself until you are at least 37 weeks, as it can naturally induce labor. I just want to preface this by saying that first latch, whether it's right after you've had your baby or whether it's a couple hours or a couple days later, that latch is not going to be perfect. You're new at this, your baby is new at this, you're both learning. It is a learning curve. So don't put pressure on yourself. It is going to feel awkward. It is going to feel weird no matter how prepared you are. It's just going to not be perfect at first. It takes practice and it takes a little bit of perseverance sometimes, but you'll get it. Just know it's not going to be perfect at first, but it will get there. I want to insert a picture, like somewhere on here of what the correct latch looks like, but just kind of going through each like each stage of the latch, I guess, or each characteristic of the latch. So what you want is your baby's top lip to be flared, like kind of like flared up and kind of like pushed out. You do not want it to be tucked under or just like flat. You want it to kind of be like a fish. So you want like the top lip flared and then the bottom lip also flared. You want your baby's jaw to be very wide. So when your baby is latching on, you don't want them to just come at your breast with their mouth just like this. You want them to be really, really wide, because you do not want them to just take in your nipple when they latch, because that's going to be extremely, extremely painful. You want them to take in some of your areola and breast tissue as well. It's not called nipple feeding, it is called breastfeeding. So you don't want them to take in just your nipple. What you want is your baby's chin to be buried into the breast. So you do not want them to be, so if this is your breast, you do not want their chin to be tucked. You want it to be up, and you want your breast to be kind of, your baby's chin to be buried into that breast tissue. This probably looks really weird, but I'm just trying to illustrate. Another really important thing is that you don't want any kind of clicking or smacking sound when your baby is breastfeeding. A clicking sound means that your baby's tongue is not protruding far enough up under the nipple and areola, meaning that they're losing suction. And then the smacking means that there's some type of broken seal or suction around like the lip area. Now that we talked about the signs of what a good latch is, now I want to talk about what a good latch isn't. So, signs of a bad latch. The first sign is called lipstick nipple, and you can look it up, but it's essentially when your nipple after your baby unlatches is in the shape of a brand new tube of lipstick. So it's kind of flattened. My son had this in the hospital, and when he unlatched and I saw that, I was like, oh my gosh, that looks like lipstick nipple. Even though it looked like he had a good latch, the fact that he was doing that, making my nipple look like a lipstick, I knew that there was something going on with his latch. So I talked to the nurses and talked to lactation consultants so we could try to troubleshoot that. So that's sign number one. Another sign that I can think of is white or blanched nipples. So blanched nipples is essentially when they're both skin colored and a mix of white. And then white obviously is what it is, white. And that is when your baby is cutting off the blood supply to your nipple. So it's causing them to turn white or that blanched color. Another thing I can think of is any like bleeding, extra soreness. Blistering is another sign of like a really, really bad latch. I just want to say that some nipple discomfort is going to be normal. It's completely normal. You're not used to this area being, stimulated so much. So it's your nipples are going to take a while to get used to that. But I do want to say, if the nipple discomfort lasts more than a couple weeks, then I would definitely look at the latch again, go see a lactation consultant, have them try to help you, and look into the possibility of a lip and or tongue tie. Pain with nursing is definitely a sign that there's something going on, and if the latch looks good, then there's something going on internal that you might want to investigate further. And then I also do want to say that nipple discomfort, soreness is normal, but if your nipples are bleeding, cracked, blistered, or you just have like shooting pains when you're nursing, that's also a telltale sign that there's something going on that you need to investigate further. Fixing a latch ASAP is of utmost importance. Babies learn so quick, and they can get in bad habits quickly. So it's important to work with your baby to try to establish that really good latch. I know that when they're hungry, they get hangry and they just want to latch onto the breast so quick, but it's important to, if it's incorrect, unlatch them and just keep trying, keep trying, keep trying, keep trying. We did talk about signs of a good latch, but I also wanted to go into some tips on how to latch your baby. The lactation consultants and the nurses will probably tell you in the hospital is to treat your breast like a sandwich and hold it like a sandwich. So I'm not going to demonstrate on myself because I think that that's just a little bit weird, but think about holding your breast like you would hold a sandwich. And then when your baby is opening their mouth, like I mentioned in the signs of a good latch part, you want your baby's mouth to be really, really wide, and you don't want to latch your baby onto the breast until they have that wide open mouth. So if you have your baby, they're rooting, they're looking for the breast, they're opening their mouth wide, it's going to be hard at first to know exactly what that moment is to latch them onto you. I remember that that was one part that I had a really hard time with when I was in the hospital with my son, knowing exactly when to latch my baby, because they are, when they're hungry, they get kind of discombobulated. They're, you know, shaking their head, like opening their mouth. They're looking for the breast because their eyesight really isn't that good yet. And it's hard to do the timing right to latch your baby on, but just give it practice. But some tips that I can tell you is to sandwich your breast, meaning you hold onto your breast like a sandwich, and that can help you in terms of like bringing your baby to you and latching them on. Another tip that I have is do not go into your baby, let your baby come to you. So you can, if you're trying to hold your baby's head to help latch them on, you can use your other hand to treat your breast like a sandwich and kind of grab your breast like this with your hand, and then you can use your other hand to have like control of your baby's, not their head, but like their neck area to help latch them onto you. If you go into your baby when latching, it can lead to nipple discomfort and back pain as well. Another latching technique, I guess, that I would really recommend is called the Flipple Method. It's kind of hard to explain. I do have a YouTube video that I found really helpful, and I'm going to put the link to that in the description box, so be sure to check that out. But essentially what it is when you're latching your baby on, you grab the side of your breast and pull back, and it pulls your nipple back. And then when you're latching your baby on, you push towards the front of your breast, and it'll kind of flip your nipple into the baby's mouth, and that helps to get like a deeper latch. So the sandwiching kind of essentially does the same thing, but if you're sandwiching, it's kind of pulling back on the breast tissue and your nipple is going up and back, and then as your baby latches on, it'll push your nipple further back into their mouth. The Flipple, it kind of does the same thing, but your nipple is going kind of sideways and then flipping into their mouth to get that deep latch. I hope that makes sense. If it doesn't, check out the Flipple Method video. It'll explain it a lot more in detail. I also have a video down below about sandwiching the breast, and that'll kind of also give you like a visual cue as to what that looks like. Okay, now I want to talk about the signs that your baby is getting milk during a feeding. When you're first starting to breastfeed, it's sometimes kind of hard to know if they're actually getting anything, especially in those first couple days when all you have in your breast is the colostrum. Babies only take in a super small amount during each feeding. Your baby on that first day when they're born, they can only take in about 1 to 1.4 teaspoons at a time. That's their stomach capacity. So it's going to be really hard at first they're not going to be gulping. There's not really much milk for them to be gulping. So here are the things to look for. You can see movement between your baby's temple and ear. That means that they're swallowing. You can see when they do swallow, you can see their jaw drop. It's not easily noticeable at first, but if you really look for it, you can tell the difference between them sucking and then when they do that slight jaw drop. And then of course, once your milk does come in, you can hear your baby gulping, and that jaw drop will be more significant. Another thing that you, one way that you can tell that your baby got enough milk during a feeding, your breasts will feel softer. Sometimes your baby, especially when they're young, their fists will be clenched a lot of the time. And when their hands open up, that means that they're relaxed. And most of the time that means that their tummies are full. So that's a really good gauge that if they're really tight and bundled up, they're not yet quite relaxed. And then as they get more milk, as they get full and sleepy, their hands will open up. I use that a lot with my son, and it always seemed to work. And then the last sign that your baby is getting enough milk, it's something called flutter sucks. And it's really, really hard to describe, but when your baby is breastfeeding, you know, they're doing that nutritive sucking. And then at the end, they'll often go into this flutter sucking. And it's just like this little, like if this is the baby's like lips, you know, they're doing that nutritive sucking, getting milk. And then as they slow down and they start to do this quiver, that means that they're full and they're just doing like comfort nursing essentially. So they're still nursing, but it's just this little quiver. And that's another sign that your baby is full. They got enough milk. I'm not really going to talk about positions in this video. There's the cradle, cross cradle, side lying, football. Those are all positions that you can try. There's so many YouTube videos out there from lactation consultants, doctors, showing you the different positions. But if anyone wants a specific video on me doing positions and then latching in the different positions, I would be happy to make that, but I'm not going to address it here in this video. Okay, so that is it for part 1 of this video. I am going to include timestamps down below in the description box. So if you need to reference any part of this video, you can just check out the timestamp and then scroll to the specific time frame that you need in the video. Please be sure to give this video a thumbs up if you enjoyed any part of it. Subscribe if you want to follow along with other videos that I make, and be sure to check out part 2 of this video. It's going to cover a few days following birth up to a few weeks after birth, all more about breastfeeding. Thank you so much for joining me today. Bye.